Hello, my name is Sandra Stenger. I'm a student at the University of Phoenix in the Masters of Nursing Online program. Today's podcast will be a brief presentation of a change project I will be leading for the Cincinnati VA Medical Center, which involves the feasibility of opening a community-based outpatient dialysis center for veterans that live in outlying communities. Hemodialysis is a time-consuming process that usually takes several hours and is required multiple times per week. The Cincinnati VA has approximately 130 veterans on service that require hemodialysis, mostly contracted to other dialysis centers because of distance from the VA campus. The Outpatient Dialysis Change Project will assess the feasibility of placing a facility in outlying communities to better serve the veterans who live there. This project would ensure VA-trained staff provided care for the specific psychosocial needs of the veteran population. Because the project would involve care being provided at an off-site location, an organizational change project will be needed to implement the plan. The forces involved in change can be recognized from both internal and external sources. As seen in a process improvement project conducted at the Royal Devon and Exeter Foundation Trust Healthcare Organization in England, organizational change can bring a great deal of accomplishment in patient outcomes and finances, but the journey of change can be a challenging one. The trust system experienced higher than usual post-surgical infection rates for breast surgeries with no apparent cause or reason and needed to address standards of care. Organizational change would be required to initiate more structured pre- and post-operative processes. External forces usually come from outside of your organization and can involve sources such as payers, referrals, or public opinion. Internal forces come from within your organization and can more easily be recognized and addressed, and may involve staff attitude, commitment, and involvement. Changing processes and practices in a healthcare system will require multidisciplinary teamwork to manage the forces of change. External forces beyond the control of the trust organization would have included lack of influence on referrals into the facility or the diagnosis or prior health of patients before surgery. External forces that will be difficult to control with the outpatient dialysis project will be the lack of influence on the location of patients. As patients cycle off dialysis either due to transplant or death, there will be no control of where newly added veterans live. Zip codes that have a heavy end-stage renal disease population now may not be the prevalent area in the future. There will also be no guarantee that staff can be recruited where the new location is needed. Strategies that may alleviate these external forces involve looking at prior veteran zip codes to see trends of certain locations. Current hospital staff being incentivized to work in the new location may also address staffing and recruitment concerns. As we look at the Trust Project, the positive internal forces that affected their plan were hospital leadership support and team buy-in. The organization chose to use Cotter's change model as a framework for their project. Because of good communication strategies, the staff was aware of the need from the beginning of the project and a sense of urgency was established. Likewise, the Outpatient Dialysis Project has leadership support because veterans may not be receiving veteran-centric care from privately managed dialysis companies. Leveraging this positive flow from leadership commitment will show organizational unity and help alleviate roadblocks because staff will see a top-down support of the project. Negative internal forces occurred with the Trust Project, and they currently exist in the Cincinnati VA Dialysis Project. Change is emotional and impacts the identities of those affected. Clinicians tend to fear change because you are asking them to alter practices they were taught or found effective. Also, changes proposed by others outside the clinical group can be viewed as suspicious and data can be questioned. Strategies to address this type of negative influence would be transparent communication regarding the need for the project and, in keeping with Cotter's model, creating a sense of urgency using impact to patient outcomes and care. A highly visible administrative group actively engaged with staff in the planning phases of the project will facilitate trust and buy-in. Within the trust organization, multidisciplinary staff members were identified and charged with designing new processes that would improve both clinical and financial outcomes for the system. The team used an evidence-based approach to research and develop consistent processes for pre- and post-surgery care, thus standardizing infection prevention. The plan was well received because early communication occurred before the project started and staff were already aware of the need. And after implementation, infection rates improved, so staff saw successes. The Outpatient Dialysis Project will also require a multidisciplinary approach to address all planning aspects of the project. A needs assessment has been established and staff have received verbal and written communication that explain the project purpose. Subject matter experts will be utilized for all phases of the project to ensure the plan is technically sound. A culture of scholarship is an environment of energy, curiosity, and creativity that will spark research and promote nursing knowledge and practice. Being involved in a project of this magnitude benefits the nurse because it not only allows evidence-based research and practice for better patient outcomes into the clinical area, it also allows nurses to engage in evidence-based research and publication of results, creating a continuing cycle of lifelong learning. I hope you've enjoyed the topic. Thank you very much for listening.